Is it really possible to increase penile length, safely and scientifically? Most men think it's all hype, but today, a urologist reveals the truth. No gimmicks, just real, medical facts that could surprise you. If you've ever wondered what actually works and what's just a scam, stay tuned. This might just change how you think about male enhancement forever. And hey, if you find this topic important, don't forget to like, comment, subscribe, and share this with someone who needs to hear it. Let's talk facts, not myths, starting right now. Lesson 1. The truth about penile size. If you've ever looked in the mirror and wondered, am I big enough? You're not alone. For millions of men, concerns about penis size can create anxiety, shame, and even affect relationships. But here's the first truth every man deserves to hear: most men are completely normal, and have nothing to worry about. Studies conducted across the world have found that the average erect penis length is between 5.1 to 5.5 inches, with the average girth around 4.6 inches. If you fall anywhere near this range, congratulations, you are perfectly average. Yet despite this, surveys show that over 45% of men believe they are below average in size. Why? It all comes down to psychology, comparison, and unrealistic expectations shaped by adult content and social myths. One of the biggest problems is visual misperception. When you look down at your own body, you're seeing from a top-down angle, which distorts proportion. Others seem larger in comparison, especially in adult films where the actors are handpicked for size. But that's not real life. What's real is how your body performs, how confident you feel, and the intimacy you build with your partner. Here's another surprising fact: a large percentage of women don't care about size the way men think they do. In a study published in the Journal of Sexual Medicine, 85% of women reported being satisfied with their partner's penis size, while only 55% of men were satisfied with their own. That disconnect says a lot. Women care more about emotional connection, technique, confidence, and mutual pleasure than raw measurements. Now, that doesn't mean your feelings aren't valid. If you're feeling insecure, it's okay to want reassurance or improvement. But the first step is understanding that you are not broken or abnormal. In fact, chasing after unnecessary enlargement techniques can sometimes cause more harm than good, especially if they aren't backed by science. From a urologist's perspective, the healthiest approach is to reframe how you see yourself. Instead of fixating on size, focus on improving your sexual health, stamina, and communication. These are things you have real control over, and they can dramatically improve your experience in the bedroom. That said, if you still feel uncomfortable about your size, even after hearing the facts, it's worth talking to a urologist. Sometimes, men suffer from what's known as penile dysmorphophobia, a condition where they perceive their penis as too small despite being average or above average. Therapy, sexual counseling, and honest medical consultation can make a major difference. So, let's summarize what you need to take from this lesson. Most men are normal, unless your erect penis is below 2.5 inches, which is clinically considered micropenis. You are within a healthy, functional range. Size is not the most important factor in sexual satisfaction. Confidence, connection, and technique matter far more. Women generally don't care about size the way men think. They care about how you make them feel. Comparison is the thief of joy. Stop measuring your worth against unrealistic examples. If insecurity persists, talk to a urologist or sexual health counselor. Don't suffer in silence. In the next lesson, we'll explore the first scientifically proven method that actually increases penile length without surgery, and how thousands of men have safely used it to gain more confidence. But before we move on, here's a reminder: if this message resonated with you, help spread the truth. Like this video, leave a comment, and share it with a friend who might need to hear this. And don't forget to subscribe, because what we'll uncover in Lesson 2 could surprise you. Lesson 2. Penile traction devices. So, now that we've addressed the truth about average size and body image in Lesson 1, let's turn to a question many men still ask: can I actually make it bigger? The short answer is yes, but not the way most late-night ads or shady internet products promise. There is only one non-surgical method backed by clinical studies and approved by urologists to increase penile length: penile traction therapy, or PTT. Let's break it down simply. Penile traction therapy involves using a mechanical device, worn around the penis for several hours a day, that gently stretches the tissue over time. It sounds like something out of a science lab, but the concept is very real and very old. The idea is based on the principle of tissue expansion, the same biological mechanism used in limb lengthening surgeries or skin grafting procedures. When tissue is subjected to consistent tension over time, the body responds by creating new cellular growth, permanently increasing length. One of the landmark studies published in BJU International tracked men who used a traction device for 6 months. The results were encouraging. Many gained between 0.5 and 1.0 inch in erect length, and some showed even greater gains in flaccid length. No pills, no surgery, just time, patience, and consistency. So, how do these devices work? Most are made from medical-grade plastic and feature adjustable tension rods that allow you to gradually increase the stretch as your body adapts. You typically wear it for 4 to 6 hours per day, broken into manageable sessions. Over time, this slow and controlled stretching stimulates tissue remodeling and microcellular growth. Now, before you jump online to order one, here's what you need to know. 1. Results take time and discipline. This is not a quick fix. Most men start seeing results around the 3-month mark, with maximum gains at 6 to 9 months. If you aren't consistent, if you skip days or wear it only occasionally, you won't see meaningful changes. 2. It must be worn properly. Traction devices must be worn correctly to avoid injury. If the tension is too strong or the device is misaligned, it can cause pain, bruising, or reduced blood flow. Always follow the manufacturer's instructions and consult your urologist before starting. 3. It's particularly effective after surgery or injury. Men who have undergone prostate surgery or suffer from Peyronie's disease, penile curvature caused by scar tissue, can benefit significantly. In these cases, traction therapy can restore lost length and improve shape and symmetry. 4. Emotional benefits are real. Beyond physical size, many men report improved self-confidence, sexual satisfaction, and partner communication. Feeling more in control of your body can have ripple effects in your entire emotional life. Now, what about safety? Traction therapy is non-invasive, meaning it doesn't involve drugs, cuts, or implants. When used correctly, it's considered very safe. That said, some discomfort is expected in the beginning. You may experience mild soreness, especially during adjustment periods. But pain should never be sharp or intense. If it is, stop immediately and consult a healthcare provider. So, why haven't more men heard of this? One word: patience. Most guys want results fast. That's why pills, pumps, and miracle creams dominate the market, even though none of them work. But the men who commit to traction therapy often say, "I wish I had started this years ago." What about girth? Penile traction primarily improves length, not girth. If you're interested in girth enhancement, that's a separate conversation involving either specific devices or more advanced therapies, some of which involve injections or implants. But again, these should only be considered under medical supervision. To recap, penile traction therapy is the only proven non-surgical way to increase length. Gains of up to 1 inch are possible, but it takes 3-6 months of daily use. It is safe and effective when done properly. Talk to a urologist before beginning to make sure it's the right option for you. In the next lesson, we'll look at another powerful but lesser-known tool, the vacuum erection device, and how it might do more than just help with erectile dysfunction. It might help with length preservation and circulatory health as well. If this helped you understand your options better, please like this video, subscribe to the channel, and share this with someone who's been secretly searching for the truth. You're not alone, and there's more real knowledge ahead. Lesson 3. Vacuum pumps: a surprising tool for length and health. When most men hear vacuum pump, they immediately think of erectile dysfunction or gimmicks advertised late at night. But what if I told you that this misunderstood device might actually play a valuable role, not just in boosting blood flow, but also in preserving and even enhancing penile length over time? Let's be clear from the start: vacuum erection devices, VEDs, are not magic. They won't add inches overnight, and they're not designed for permanent length gains like traction devices. But recent studies show that when used consistently and correctly, vacuum pumps can have remarkable benefits for penile health, especially as men age or recover from surgery. So, what exactly is a vacuum erection device? A VED consists of a plastic cylinder that fits over the penis. Once placed, the user manually or automatically pumps air out of the cylinder, creating negative pressure that draws blood into the penis. This results in an erection. A constriction ring may be placed at the base to maintain the erection during intercourse. But here's where it gets interesting: when used daily, not just for sex, but as part of a routine, this pumping process increases blood flow, stretches the penile tissue, and can prevent or reverse shrinkage caused by age, surgery, or disuse. Penile atrophy, a hidden problem. As men get older, or if they go through long periods of sexual inactivity, it's common for the penis to lose elasticity and shrink slightly in size. This condition, known as penile atrophy, is especially common in men who've had prostate surgery, diabetes, or vascular problems. In some cases, men can lose up to an inch of length simply due to poor circulation and lack of erections. That's where the VED comes in. According to research published in Urology and the Journal of Sexual Medicine, men who used vacuum pumps regularly, about 10 to 15 minutes per day, several times a week, showed improvements in length, girth, and erectile quality. While the increases weren't dramatic, typically 0.25 to 0.75 inches, the key takeaway is that these men stopped losing length. And many regained what they had lost. How it helps your overall health. Here's the science. Strong, consistent blood flow is critical for keeping penile tissue oxygenated and flexible. When the penis remains flaccid and unused for long periods, tissue fibrosis, scarring, can set in. A VED works like a workout for your penis. It keeps the tissue healthy, oxygen-rich, and active. In fact, many urologists recommend vacuum pumps as part of a penile rehabilitation program after prostatectomy. Used alongside traction therapy, it can enhance overall results and help men regain both function and confidence. How to use it properly. Use without the constriction ring for therapy purposes. The goal is not just to maintain an erection but to improve blood flow and tissue expansion. Go slow and steady, pump gradually until a full erection is achieved. You should feel pressure but not pain. Limit sessions to 10-15 minutes, once or twice a day. More is not better and can lead to bruising if overused. Stay consistent like any therapy. Results come from routine use over weeks and months. Important cautions. While VEDs are generally safe, they do have limitations. You should never use them if you have certain blood disorders, take blood thinners, or are prone to bruising without medical clearance. Also, improper use, like excessive pressure or overuse, can cause discomfort, swelling, or bruising. But when used correctly and under guidance, the benefits are undeniable. Who benefits most from VEDs? Men recovering from prostate or pelvic surgery. Men with diabetes or vascular issues. Men experiencing age-related shrinkage. Anyone wanting to maintain or modestly improve length without surgery or drugs. A confidence boost you can feel. The greatest benefit of all? It's mental. Many men report that daily VED use helps them feel more confident, more in control, and more sexually alive. Knowing that you're actively investing in your sexual health, not relying on luck or myths, is powerful. So, what's the bottom line? Vacuum pumps won't make you a new man overnight, but they can help preserve what you have, improve circulation, enhance erections, and support modest size improvements, especially when used as part of a bigger plan that includes traction and a healthy lifestyle. In Lesson 4, we'll talk about a hidden cause of perceived size loss that no one tells you about: belly fat. Yes, your stomach might be burying your inches, and we'll show you how losing weight can literally uncover them. If you're enjoying these science-backed lessons, please like this video, leave a comment, and share it with your friends. And don't forget to subscribe. The next tip might be the most surprising of all. Lesson 4, Weight Loss: How Belly Fat is Hiding Your Inches. Let's shift focus from gadgets and devices to something hiding in plain sight: belly fat. That's right, one of the biggest enemies of your perceived penile size isn't your genetics, your age, or even your hormones, it's your gut. And this might be the most underrated penile enhancement tip of them all. The illusion of shrinkage. Have you ever looked down and thought, wasn't it bigger before? Many men believe they've lost length. But what's actually happened is that excess fat in the pubic area, called the suprapubic pad, has expanded, swallowing up visible length. The more fat accumulates around the base of the penis, the more it appears to recede. This isn't just about appearance, it's physics. On average, every 30 to 40 pounds of excess weight can hide up to an inch of visible penile length. Imagine what reclaiming that inch could do for your confidence and function. This is not just cosmetic. That hidden length may affect how you feel during intimacy and even interfere with full erections. Especially if the fat pad is large enough to restrict blood flow. The science behind it: fat around the lower abdomen and groin isn't just sitting there harmlessly. It's metabolically active, producing estrogen, inflammatory compounds, and disrupting hormonal balance. This can lead to lower testosterone, decreased libido, and difficulty achieving or maintaining an erection. It also contributes to conditions like metabolic syndrome, diabetes, and vascular disease, all of which impact sexual health. Weight loss equals natural enhancement. Unlike devices that require money and time, losing weight gives you results across the board: not just in the bedroom. But yes, a leaner belly will literally reveal more of your penis, enhance erections, improve stamina, and boost confidence. Here's what the research says. A study published in the Journal of Sexual Medicine found that men who lost weight reported improved sexual performance, higher testosterone levels, and greater satisfaction. Another clinical trial showed that reducing abdominal fat visibly increased penis length and improved self-image, even without any devices or procedures. Weight loss also reduces the chance of erectile dysfunction by over 30% in overweight men. How much should you lose to see a change? For many men, even 10 to 15 pounds can start making a visible difference. Losing around 30 pounds or more often results in 0.5 to 1 inch of extra visible shaft, with no surgery, no pain, and no expense. But the real magic happens when you combine fat loss with a structured sexual health plan, like traction therapy, vacuum pumping, and hormone optimization. These methods work synergistically, with weight loss amplifying the benefits of each. How to target the pubic fat pad. You can't spot reduce fat, but you can strategically target the lower belly with overall weight loss, core training, and inflammation-reducing diets. Here's how. Adopt a clean diet. Focus on whole foods, lean proteins, leafy greens, berries, nuts, and healthy fats. Avoid processed carbs and sugar. Try intermittent fasting. Many men over 40 benefit from time-restricted eating. It improves hormone balance and reduces visceral fat. Lift weights, walk daily. Resistance training boosts testosterone, and walking burns calories without stressing your joints. Sleep and hydration. Poor sleep leads to cortisol spikes, belly fat, and dehydration makes you feel more fatigued and bloated. Don't forget posture. Believe it or not, poor posture, especially excessive sitting, can tighten your hip flexors and tilt your pelvis in a way that makes your stomach protrude and your penis appear even smaller. Stretching your hips and strengthening your core can change your silhouette and enhance your profile from the front. Psychological impact of shedding the fat. Let's be honest, when your belly is smaller and your body is firmer, you feel more like a man. You walk taller, you approach your partner with more confidence. That confidence translates directly into better intimacy, deeper connection, and greater pleasure for both of you. Men often say, "I didn't realize how much weight was affecting my sex life until I lost it." And they're not just talking about endurance or desire, they're talking about how their body looked and felt when naked, and how much better it felt to see the full length of themselves again. In conclusion, belly fat hides inches of your penis. It doesn't shrink it, but it buries it. Losing even 15–30 pounds can visibly add length, improve erections, and raise testosterone. This is a permanent, natural, and side effect-free way to enhance size and performance. In Lesson 5, we'll explore hormonal balance, especially testosterone, and how optimizing it can supercharge your results, improve erections, boost energy, and even influence perceived size. If this eye-opening lesson helped you, go ahead and like, comment, and share this with someone who needs to hear it. And hit that subscribe button so you don't miss Lesson 5. Your hormones might just be the key to everything. Lesson 5, Testosterone and Size, the hormone every man should respect. When it comes to male vitality, confidence, and performance, testosterone is king. This powerful hormone is responsible for everything from deep voice and muscle mass to libido, mood, and yes, even penile health. Most men think testosterone just affects sex drive. But in reality, low testosterone levels can make your penis appear smaller, feel less responsive, and even shrink slightly over time. If you've been feeling less like yourself, struggling with poor erections, or noticing size changes, your testosterone might be calling for attention. Let's dive deep into how T levels influence not just performance, but penile function and appearance. Testosterone's role in penile health. During puberty, testosterone triggers the growth of the penis and testicles. But even in adulthood, healthy T levels maintain penile tissue structure, blood flow, nerve sensitivity, and vascular health. Low testosterone, also known as hypogonadism, can lead to weaker, less frequent erections, lower libido and sexual motivation, penile tissue atrophy, shrinking or softening, loss of nocturnal and spontaneous erections, reduced sensation and pleasure. In long-term low T cases, men have reported losing up to half an inch or more in visible length, simply due to disuse and diminished blood flow. Signs you may have low testosterone: fatigue and low energy, decreased sex drive, depression or irritability, difficulty gaining muscle or losing belly fat, trouble maintaining firm erections, brain fog or poor concentration. The truth: Many men in their 40s, 50s, and 60s start to gradually lose testosterone each year, often without realizing the full effects until it impacts their bedroom confidence. Scientific proof, T levels and penis size. A study published in the International Journal of Impotence Research found that testosterone therapy in hypogonadal men helped restore penile size, improve erectile quality, and increase satisfaction. Why? Because testosterone enhances nitric oxide production, which improves blood vessel dilation, crucial for strong erections. In another clinical trial, men with low T who received testosterone replacement therapy, TRT, experienced increased morning erections, improved erectile strength and frequency, slight but noticeable increases in erectile length, higher confidence and mood. This doesn't mean testosterone therapy is a magic pill, but for the right man, it can be life-changing. How to naturally boost testosterone. Before jumping to therapy, many men can raise their T levels naturally through lifestyle changes. Here's what science supports. 1. Lift heavy weights. Resistance training, especially compound lifts like squats and deadlifts, stimulates testosterone production. Aim for 3-4 sessions a week. 2. Get quality sleep. Testosterone is mostly produced during deep sleep. Just 1 week of poor sleep can cut T by 15–30%. Prioritize 7–8 hours of quality rest. 3. Reduce belly fat. Fat tissue converts testosterone into estrogen. The more abdominal fat you have, the lower your T-dropping belly fat can reverse this trend fast. 4. Cut out endocrine disruptors. Avoid plastics with BPA, processed foods, and soy-based additives. These chemicals mimic estrogen and lower testosterone levels. 5. Boost vitamin D. If your levels remain low despite lifestyle changes, it may be time to consult a urologist or hormone specialist. A simple blood test can check your total and free testosterone. TRT, testosterone replacement therapy, comes in various forms. Gels or creams, injections, weekly or biweekly, pellets inserted under the skin, oral capsules, newer options. Men on TRT often report higher sex drive, better erections, improved mood, more energy, and even better body composition. But TRT isn't for everyone. It must be monitored closely, as improper use can affect fertility, heart health, or prostate size. Always work with a licensed medical provider who specializes in men's hormones. The bottom line, testosterone doesn't just fuel your desire, it protects and maintains the physical structures responsible for your pleasure. When your levels are optimal, you think clearer, feel stronger, perform better, and yes, appear larger and more confident. If your size and strength don't feel like they used to, it's not just aging, it might be your hormones sending a distress signal. In Lesson 6, we'll explore a little-known but powerful method that can visibly increase length over time, traction therapy, a method approved by urologists and backed by science. If this lesson gave you clarity, confidence, or curiosity, go ahead and like this video, leave a comment, and share it with other men who need this truth. And don't forget to subscribe. Lesson 6 could change how you think about progress forever. Lesson 6, Traction Therapy, the urologist-approved way to add real length. Let's be honest, most penis enlargement promises on the internet are just that, empty promises. Pills, potions, and bizarre gadgets dominate the conversation. But if you're serious about increasing length safely, gradually, and with real clinical evidence behind it, then you need to hear about traction therapy. This isn't some underground gimmick. It's been clinically studied, approved by many urologists, and recommended in academic journals as one of the only non-surgical options that actually works, when done correctly. Let's break it down so you know how it works, why it works, and how to use it effectively. What is traction therapy? Penile traction therapy, PTT, involves wearing a device that gently stretches the penis over time. These devices apply consistent, measured tension to the shaft, which stimulates tissue growth through a natural process called mechanotransduction. Put simply, your body responds to gentle, continuous stretching by growing new tissue, just like how braces gradually move teeth or how certain cultures elongate earlobes or necks. And the results? Real, measurable increases in penile length, especially for men who are consistent and patient. Backed by science, let's get into the research. A 2011 study in BJU International followed men who used a traction device for 6 months. The average increase in flaccid length was 1.7 centimeters, 0.67 inches, and erect length increased by 1 centimeter, 0.43 inches, with no serious side effects. Another study in the Journal of Sexual Medicine found that after 3 months of consistent use, 4-6 hours per day, men gained 0.5 to 2.5 centimeters, up to 1 inch, in length. Even more importantly, patient satisfaction was high, with many reporting improved self-esteem, confidence, and performance. Urologists often recommend traction devices to men with Peyronie's disease, curved penis, post-surgery patients, or those with penile shortening due to aging or prostate treatments. If it works for those challenging cases, it can work for healthy men too, if used properly. How does it work? Traction therapy is based on these core principles. Gentle, sustained stretching, the device applies low tension force along the shaft. Cellular microtrauma, the mild stretch triggers microscopic cellular damage. Tissue remodeling, the body responds by laying down new cells, increasing length over time. Collagen realignment, in men with curvature, the stretch can straighten and lengthen the shaft. This is not instant, it's a slow and steady process. Think of it as the gym for your manhood. How to use a traction device safely. Success depends on discipline and technique. Here's a step-by-step approach. Choose a quality device. Look for FDA-registered or urologist-recommended brands like Andropenis, Penamaster PRO, or Size Genetics. Avoid cheap, untested knockoffs. Start slow. Begin with 1 to 2 hours per day in short sessions. Gradually build up to 4 to 6 hours per day, 5-6 days a week. Apply correct tension. Too much force can damage tissues. Most devices include adjustable tension. Aim for comfort, not pain. Be consistent. Wear it consistently for at least 3 to 6 months. Results take time, just like growing muscle. Pair with massage or jelqing, optional. Gentle massage before and after sessions can improve blood flow and reduce soreness. Stay clean and comfortable. Wash the device regularly. Wear it under loose clothing. Some men use baby powder or cushioning to prevent irritation. What results can you expect? First 1-2 months, you may notice increased flaccid hang due to improved circulation and tissue loosening. 3-6 months, gradual, measurable increases in both flaccid and erect length. Many report 0.5 to 1 inch gains. Beyond 6 months, gains may slow down but can continue with regular use. Importantly, traction therapy does not increase girth significantly. It's primarily for length. If girth is your focus, we'll cover methods in Lesson 7. Common concerns. Does it hurt? No, when used correctly, it should not hurt. Mild discomfort is normal at first. Is it permanent? Yes, most gains are permanent if maintained for 6 months. Some suggest occasional use afterward to maintain results. Is it embarrassing? Remember, you're doing this for you. Confidence in the bedroom starts with how you feel about your body. Final thoughts. Traction therapy is not a gimmick. It's a urologist-approved, scientifically supported method for men who are willing to be consistent and patient. No surgery, no hormones, no side effects, just biology and time. It's not about vanity, it's about confidence, ownership, and the choice to improve yourself naturally. In Lesson 7, we'll explore girth enhancement, because for many men and their partners, thickness matters just as much as length. If you learned something new, be sure to like, comment, and share this video. And don't forget to subscribe so you're first to see Lesson 7, Girth Matters: Natural Ways to Increase Thickness Without Surgery. Lesson 7, Girth Matters: Natural Ways to Increase Thickness Without Surgery. Most men focus on length, but let's talk truth. Girth, thickness, is often more important to women when it comes to pleasure. A thicker penis provides more contact, more stimulation, and a fuller feeling during intimacy. It also gives men a more confident, dominant appearance when erect. While surgical girth enhancement exists, it's expensive, risky, and often unnatural in look and feel. The good news? There are natural, safer ways to gradually increase penile thickness that are backed by experience and emerging science. Let's explore how to build girth naturally, effectively, and without harming yourself. Why girth is so important. Multiple studies and sexual health surveys have confirmed that many women rate girth as more satisfying than length. Why? Because vaginal nerve endings are mostly located near the entrance, and a thicker penis provides more friction and pressure during intercourse. For the man, increased girth can result in stronger, firmer erections, a more powerful presence, better confidence during foreplay and intercourse, a more aesthetic, robust look. So how can you increase girth safely and naturally? 1. Jelqing, the classic thickness exercise. Jelqing is one of the oldest and most widely practiced methods for improving penile girth. It involves massaging the penis in a semi-erect state using controlled hand movements to push blood through the shaft. How it works. Increases blood volume in the corpora cavernosa, erectile chambers. Stimulates tissue expansion over time. Improves vascularity and erectile response. How to do it: warm up with a warm towel wrap for 5-10 minutes to loosen tissues. Achieve a 50-70% erection, not fully hard. Make an OK sign with your thumb and index finger at the base. Slowly move your grip up the shaft, applying gentle pressure. Repeat for 10-15 minutes, 3-5 times a week. Caution: never jelq when fully erect. Use a light grip and stop if you feel pain or numbness. With months of consistency, many men report 0.3 to 0.7 inches of increased girth, and stronger erections overall. 2. Pumping a girth booster with a medical edge. Penis pumps, also known as vacuum erection devices, VEDs, create a vacuum around the penis that increases blood flow and engorges the tissue. When used regularly and safely, they can stimulate temporary and eventually semi-permanent girth gains. Clinical use. Urologists often prescribe pumps for men with erectile dysfunction. Some studies show girth and length gains with regular use over several months. Best practices. Use a quality pump with a gauge to avoid overpumping. Apply a warm lubricant and begin at low pressure. Pump for 10-15 minutes per session, 4-5 days a week. Do not overdo it. Swelling or pain is a warning sign. Over time, users often report noticeable girth improvements, along with stronger, fuller-feeling erections. 3. Kegel exercises build internal muscle for external size. Kegels aren't just for women. For men, strengthening the pelvic floor muscles can lead to harder, longer-lasting erections, improved blood retention in the penis, enhanced ejaculatory control and intensity. The stronger your PC, pubococcygeus, muscle, the better your body is at trapping blood inside the penis, giving the appearance of greater thickness during arousal. How to do Kegels. Squeeze the muscles you'd use to stop urine midstream. Hold for 3-5 seconds, then release. Repeat 10-15 reps, 2-3 times daily. Combine Kegels with pumping or jelqing for maximum effect. 4. Supplements that support girth goals. No supplement alone will make you thicker, but certain nutrients support blood flow and tissue repair, enhancing the results of physical techniques. Top choices: L-citrulline, L-arginine, boost nitric oxide for better vascular expansion. Vitamin E, promotes tissue elasticity. Collagen and protein, support cellular repair and growth. Ginkgo biloba, enhances blood flow and vascular response. Consistency is key. Think of supplements as fuel, not magic. 5. Lifestyle habits that help. Stay hydrated. Dehydration can reduce penile size and elasticity. Eat healthy fats. Omega-3s and good cholesterol support hormone and blood vessel health. Avoid smoking and alcohol abuse. These constrict blood vessels and kill gains. Get quality sleep. Testosterone production happens during deep sleep. Protect your hormonal health. What to expect. First 1-2 months, temporary swelling or pump after exercises. 3-6 months, steady increase in baseline girth and firmer erections. 6 months, noticeable gains that persist even without stimulation. Remember, girth enhancement is a long-term project, not an overnight trick. But the payoff is real, physically, emotionally, and intimately. Final thought: increasing penile thickness isn't about vanity. It's about feeling more in control, more capable, and more connected with your partner. These techniques are natural, safe, and proven over time by thousands of men, and increasingly respected by medical professionals. You've now completed the full 7-lesson journey. If this video helped you reclaim your confidence, or gave you a strategy worth trying, don't forget to like, comment, and share it. You never know who else might need this guidance. And if you're ready for more male health secrets and expert-backed insights, subscribe and join us for the next video.